Good evening, everyone. My name is Taylor Patton, and I'm an Advocacy Associate here with the International Myeloma Foundation, and we really appreciate you coming out tonight. This is going to be our webinar presentation, Advocacy in August, How to Connect with Your Representative at Home, where we explain to you all how to advocate and meet with your legislators while they're at home in district, while they're on recess during the August break. Before we get started, I would like to first thank our sponsors, Celgene, the Biotechnology Industry Organization, or BIO, Astellas, Takeda Oncology, and Bristol Myers Squibb. Also, a few things that I'd like to go over before we go ahead and get started, just some logistical things and housekeeping items. If you have questions as we're going through the webinar, there is a Q&A box on the right side of the screen where you can type in your questions. Feel free to type them as you come across them during the presentation, and we will, of course, have time to answer those afterwards. I'm also going to be muting all of the phone lines, and once the presentation is finished, I'll go ahead and unmute those so that anyone that is on the phone can also ask any questions that they have that way as well. All right, so having said that, we'll go ahead and get started. So tonight, just to go over the agenda, we're going to just be talking briefly about what advocacy is, as well as the issues that the IMF follows, and what you can do to help get oral parity passed, whether that be through communications, engaging directly with your representatives, and then making sure that you follow up with those representatives and their staffers after your visit. And then, of course, we'll have questions at the end. So what is advocacy, and why is it important? So advocacy is defined as the support or defense of a cause and or pleading on behalf of another person. However, just because you can do that for another person, you can also be your own self-advocate. In my role as an advocacy associate with IMF, it's my job to, really work on behalf of you guys and make sure that what issues you see are important are heard and are fought for. However, you can also do that yourself. Remember that policymakers work for you, and don't ever forget that, because your tax dollars pay for all of the things that they enjoy, their salaries, their benefits, their health insurance, all of that, as well as any travel that they do while they're on the job. So ultimately, it is their job to listen to you and to be respectful and to listen to your issues and your grievances. So that way, they are required to make sure that you are heard and that anything that you may have an issue with is addressed. So generally, the IMF likes to follow legislation that is guided by the following principles. And so we're going to look out for legislation that ensures quality access for all cancer patients, whether that be through treatment, research, appropriation. All of it is going to be equitable. We also look to follow policies that reform and streamline procedures that grant early approval and access to new treatments. We also support innovation to help develop additional and newer cancer treatments, as well as research to uncover the causes of cancer and even potentially a cure. Also, as we're working on all of these legislative issues and trying to get these passed, we don't work inside of a vacuum. The IMF also works with several other cancer organizations and health-related organizations that align with our principles and align with our goals, and together we work with one another to help achieve those goals. Just to list a few that we have below, we have the Patient Equal Access Coalition, as well as the State Patient Equal Access Coalition, which the IMF spearheads, as well as some of these other ones that you see here. Some of them are focused more on health research, some of them are focused more on appropriation, some of them are focused more on oral parity, which is an issue that we'll go into later. So as I mentioned, the IMF operates both PEAK and SPEAK. PEAK, or the Patient Equal Access Coalition, is our federal coalition that works on all of our national policies, as well as SPEAK, which is the State Patient Equal Access Coalition, which is more geared towards the state. These coalitions have been largely successful so far. SPEAK, we've had 40 states pass oral parity legislation, as well as the District of Columbia, and so far this session in our for our federal bills, we've had two introduced. One is in the House and one is in the Senate. And so we've been very active in our federal coalition peak as well. So as I mentioned, oral parity is the IMF's #1 legislative policy right now. And for those of you that are unfamiliar with what that is, oral parity is essentially getting insurers to update their benefit designs to make sure that oral anti-cancer medications are covered as equitably as their traditional infused IV counterparts. So, for example, you may go see your physician and they may say, hey, we're going to put you on this IV medication. And you will go and pay a copay. It's usually pretty minimal, $20, $30, $40. And that covers everything that you do within that visit, including your infusions. However, at some point, your doctor may decide, hey, I think that we need to put you on this oral medication for this stage of your treatment. And most oral medications under most insurers and in their benefit designs, they're on the prescription benefit, which means that you usually have to pay a higher cost sharing. Usually it's a coinsurance of 20 to 30 to 40% of the total cost of the medication. So you may have a drug regimen that costs $10,000 a month, and if you have a coinsurance of 20%, I mean $2,000 a month is still pretty hefty. So that's something that oral parity is intended to negate and make those two costs equitable so that you don't have to pay an outrageous amount for your treatment just because your doctor decides that it should be in a pill form versus a infused form. These bills are similar to state legislation, and they would require health plans to cover chemotherapy as equitably as oral medications, as I said. Also, they were introduced in the House and the Senate on June 11th, 2015. So just a little while ago, our House bill is H.R. 2739 and S. 1566. And we've got some great sponsors for both of those bills in the House and the Senate. In the House, we have Representative Leonard Lance from New Jersey and Brian Higgins from New York. And then in the Senate, we have Senator Franken from Minnesota, as well as Senator Kirk from Illinois that are our sponsors for those bills. So also, I just want to go over the political process in general and how bills become laws and what you can do throughout that process to help move that along. So first, before you even have a bill introduced, you have to find a great sponsor, a great leader. And as I've mentioned on the last slide, we do have some great leads for our House and Senate bills with Representatives Leonard Lance and Brian Higgins, as well as Senators Kirk and Franken. And once you've found those champions, the ones that are going to go through and bring on more co-sponsors and help you push this issue through the House and the Senate respectively, it's going to be introduced. And then once it's introduced, it's going to have to go to a committee of jurisdiction where it's debated and voted on. And so most of the bills that we're going to work on in the IMF are going to go through health-related committees. Obviously, this is a cancer organization, so those are going to be the committees that are more relevant to us. And both the House and the Senate has its own versions of these health-related committees. So in the House, you have the Appropriations Committee, which has a subcommittee on labor, health, human services, education, and appropriations. The Energy and Commerce Committee also has a health subcommittee, as well as Ways and Means. And then in the Senate, they also have an Appropriations Committee. Their version of ENC essentially is the Health, Education, Labor, and Pensions, or HELP Committee. And then finally, they also have a Finance Committee, which also has a health subcommittee. So after the bill has been discussed in committee and all of the members of that committee have voted it out, it moves to the full floor for a vote by the chamber as a whole. Because at that point, it then passes out of the House and the Senate. There may be differences in the House bill versus the Senate bill, at which point both houses have to come together to reconcile those differences before they can then send it back out. So they have to produce an identical version of the bill that can then be sent to the president's desk. Once that happens, it is either signed by the president, at which point it becomes law, or it is then sent back down and the process has to be started all over again if the president decides to veto it. So why does it take so long? passing legislation can be a very frustrating process. I know that for our federal bills, we have been working on it for a few Congresses right now. This will be our third. And that's just because no matter how worthy the cause, how strong the advocates, there is still a certain level of politicking that is going on. Just as we, at the IMF, in conjunction with some of our other patient advocacy groups like the American Cancer Society, the Leukemia and Lymphoma Society, and others, try to get legislators to work on this issue and pass this issue, there are still others that are also on the opposite end. They're on the opposing side. They're also trying to get their interests seen and heard, and they also would like to get amendments added to the bills that may or may not make them as effective. And so legislators, in doing their due diligence, have to research both sides and make sure that both arguments are valid or which side has a better argument. And it's just a very difficult process, and it can often be challenging. But the important thing to remember is that you need to stay optimistic. You need to make sure that you continue to push, even as frustrating as it may be, simply because any small step forward can be considered a huge success. So we're really trying to get the bills this session into the Energy and Commerce Committee so that they can be heard there. That would be considered our next huge step for these bills. However, I mean, of course, we're going to continue to push for their passage, but right now the next big step that we're looking to is getting them into the Energy and Commerce Committee. And having said all of that, I would actually like to turn it over to my colleague, Lindsay Trishler, who's also an advocacy associate with the IMF, so that she can talk about what you can do as patient advocates to help pass oral parity.
Hi, everyone. I'm just going to go over some of the most popular and easiest ways for you all to connect with your representatives and express to them how much oral parity means to you. The first way would to be writing to your legislator. You can do this through a handwritten letter or an email, or you can use the IMF's Engage system and write it just from there. You always want to make sure whenever you're using written correspondence that you outline the issue briefly and explain what oral parity is, and then include a personal story. Personal stories are really important for the legislators to hear because, number one, you're their constituents and they want to hear what's going on with you, and two, because it really puts the problem in perspective and it gives a face to what they're talking about. If you decide to forego the engagement system that the IMF has for you, this would be the appropriate addressing correspondence if you choose to do a handwritten letter or an email. The next way you can connect with your representatives is through social media. Social media is extremely easy to use, and you can also reach a multitude of audiences, including other advocate groups, as well as local media outlets. Ways to use social media is to either thank your representative for co-sponsorship of the bill, or also asking them to sponsor the bill if they haven't yet. Politicians especially love to be thanked because they love it when people recognize that they did a good thing. When you're using social media, it's important that you use the handle of the representatives. That way they recognize that you are trying to talk to them. And also you need to use the oral parity hashtag, which is hashtag oral parity. That way when people search, they can see that that's what you're talking about. Op-eds function the same way as social media in a sense that you can let other people know that oral parity is an issue that you're fighting for. Op-eds are articles written in the newspaper that are not written by the journalists, and it gives the community a way to see that this is an issue as well as hear from people that it's affecting. When your content of the op-eds should follow the same way of a written correspondence with the legislator in that you want to explain what oral parity is, as well as give your personal story and how you are affected by the lack of oral parity. Additionally, you can also thank your representative for co-sponsoring and also put pressure on them to co-sponsor if they have not already. One of the best ways to connect with your representatives is to go and visit them. The first step is to schedule a visit. You should look on your representative's websites first because most of them have easy online portals to schedule the visit. If not, there'll be a number for their office, so you'll just want to call and you'll talk to their scheduler who will make an appointment for you. Often you'll have to include information like why you're there and your contact information so that they can get everything down. Sometimes your senator or representative is not going to be able to meet personally with you, So you'll meet with a representative from their office, and that's most often their legislative assistant that deals specifically with health issues or their staff director. If you can't get a meeting with anyone, you should go to a town hall meeting, which is an opportunity for the community to get together and talk about the issues with their representative in a larger format, which can also be beneficial because then more people are hearing about oral parity and that it's an issue. The best way to visit your representatives is in a small group. I would suggest maybe trying to get your support groups together and see if you can schedule a time where you can meet. Some tips for when you're visiting in a small group is just to make sure that you guys have everything planned out what you're going to say, that you have a team leader, that you know who's saying what. That way you make sure that all your points are made and you're not forgetting anything. When you leave, make sure that you say thank you and that you leave behind any materials that you have, which if you do go on a visit, Taylor and I and the rest of the advocacy team are more than happy to provide you with leave behind materials and talking points so you're prepared. So speaking of talking points, what do you talk about? First, you need to ask the staffer if they're familiar with multiple myeloma, and if not, give them a little explanation, and do the same with oral parity as well. Not all of them realize that there's a bill that's been introduced and that it's a big issue. So make sure that you're ready to have a concise explanation of each. And then you want to go to your ask, which technically your ask is to have them co-sponsor the bill. And you also want to make sure that you tell your personal story. Again, this is what makes a difference to the lawmakers. They see that the problem has a face and that it's something that their constituents are struggling with every day. Tips for a successful visit is to just be on time and patient and flexible. The staffers are very busy, so you may have less time than you had anticipated, but you just need to work with it. You also need to make sure that what you're saying is organized. That way you don't forget anything or you don't talk over one another or miss something important that you wanted to say. Also, a lot of the staffers can be very young, so don't be surprised if someone just out of college is who you're meeting with. Finally, if they ask you a question and you don't know, it's okay to leave it out and reach out later with the answer. You need to enjoy yourself because you're coming to talk to them, and you guys are the experts. Don't be nervous. You know a lot more about the topic than they do, and you're there to educate them, and they're excited to hear from you. So what happens after you meet with them? Well, like I had mentioned, if they have a question that you need to answer, that's a great way to reach out. But even if they don't have something you need to follow up with, you need to make sure you email them and thank them or the staffer for meeting with you. And you also need to offer to be a resource for oral parity legislation moving forward. But also if they have any questions about multiple myeloma, let yourself be a resource for them. That way you can foster a good relationship with your office. Finally, we'll leave you with these two quotes from Plato and Bart Simpson just about the importance of being involved in the political process and advocating for yourself and speaking up for the things that you need. After all, the politicians do work for you. This is also a list of other advocacy resources, including the IMF Advocacy website and Twitter and Facebook information. On the advocacy website, you can find the engagements I had mentioned, so you can contact your legislator, as well as any updates on where the bill is in the political process and more of what the bill does. I've also included the websites and Twitters for Peek and Speak, which I encourage you all to follow to stay up to date on what's happening on both the federal and the state levels. And then finally, Taylor and I can be your biggest resources. We're available always, and we're more than happy to answer any questions. Like I had mentioned, if you are going to go visit your representative, please let us know. That way we can follow up with them as well. And that way we can send you the proper materials and leave behinds and talking points so you can be prepared for the visit. Thank you all and have a good night.
Thank you, Lindsay. Now we can go ahead and open up the phone lines for any additional questions that you guys may have, and I'll go ahead and go over some of the questions that people have left in the Q&A box. Let's start with, I received a question from Jack, and he asked if the federal bills apply to Medicare or if that is yet another possible bill. The answer to that question is no. Unfortunately, the bills at the federal level right now do not cover the Medicare population. However, we're planning on talks with CMS later this month on the 26th to see if we can get them to budge on that and see if we can come in from the CMS side of things and get them to cover this issue as well as tackle transplant. We're trying to talk to them about their transplant policies and see if we can get them to expand those to broaden them to what they currently are. And we did actually circulate a survey regarding experiences with both this oral parity issue as well as transplant issues through CMS. We did send that out in a link. Probably what we'll do is send it out again within this week or next week to kind of blast that and see if we can get any more feedback from you guys. If you didn't have the opportunity to submit your surveys, we'll give you another opportunity. All right. I also have a question from Jerry, who asked if we had a list of national and state legislators who have stated where they stand on the proposed bill. We actually do have a list of the legislators at the federal level who have signed on as co-sponsors. If you go to the Action Center for the IMF and the Advocacy team, there is a section for bills. And if you go and look at the bills, it shows you all the ones that we're currently tracking. And if you go and click on the bill numbers for our federal ones, which would be HR 2739 and S 1566, those will give you a list of all of the senators and representatives who have signed on for the bill. As far as the state bills, I don't know that we have a collection of those on the Peek and Speak website of who has signed on to the previous bills, but I know that for state bills that are currently being for bills that are currently in session, if you go to the State House website and look at the bill number there, it will also list who is signed on to that bill as a co-sponsor. I have a question from Harold that was asking, how do we save a copy of the slides? This will be recorded and posted to the website so that you will always have access to it whenever you need it. And then Harold also asked, will we still need state oral parity bills if the federal bills are passed? The answer to that is yes, because what happens is that the state bills cover the state-regulated plans, and the federal bill will cover what are known as ERISA plans, and those are private insurance market, federally orchestrated plans. And so both of them will work together to cover the broadest population base. And then, as I said earlier, to cover the last remaining piece, which would be the Medicare plans, we are going to talk to CMS to see if we can get them to cover those and see what issues that they have with that and expanding those and providing access to those at a later time. Jack also sent me a nice reminder that says also offer to be a resource in case they have a constituent contact. So if a legislator has a constituent that has an issue with myeloma or needs some additional assistance, feel free to send them our way, and we can also be that. Or if you guys would like to serve, as Lindsay was saying in her portion of the presentation, if you formulate a relationship with your representative, you can also serve as a resource for them, allowing them to be able to reach out to you and provide some additional information for any other constituents that they have in their district that might not know much about myeloma or would like to get involved, and you can become a resource there. Now we can open up the telephone lines. Okay, there we go. All the lines have been unmuted. So do you have a question, Mary?
Yes, I was wondering if you would please explain exactly who will be covered by the congressional bills when they're passed if CMS and Medicare are not covered. Because I think that's very confusing for most people.
Okay, sure. So the federal bills will cover...
Okay, so last night it was crunchy. I don't think it's crunchy.
The federal bills will cover ERISA plans, which are Employee Retirement Income Services Act plans. So those are going to be the ones that are operated through the government, but they are funded through private insurance. So those will be the population that the federal bill covers, in addition to maintaining the coverage for the state-regulated plans within the state. So it will cover group insurance, small group insurance plans, as well as private insurance individual plans that are both operated through ERISA as well as the state-regulated marketplaces.
Okay, so it's not covering Medicare plans.
No.
All right. Does anybody else have any other questions? All right. Well, we thank you guys for taking the time out of your night to listen to us and hear about advocacy and what we can do to help you guys, as well as what you can do to speak to your legislators. Sorry about that. I got muted. We thank you for coming out tonight, and we really appreciate you listening. And like I said, this webinar will be posted to the IMF website for you to view later. And we will also send out, as I said earlier, we'll send out that CMS survey again to you guys, just so you have the opportunity to give your feedback on that and give us some more insight into what you're specifically looking for that we can bring to CMS's attention. And we really look forward to working with you all. As Lindsay said, we are always a resource to you, or to all of you. We are more than happy to answer any questions that you have. As you can see from this slide here, this is our contact information. Feel free to utilize that whenever you need to, and reach out to us via phone, email, and we'd be more than happy to talk to you. Having said that, we wish you all a good night, and we look forward to speaking with you soon. Thank you, everyone.